So, breast implants. Hello, dear friends, dear guests, dear patients. Today's topic are breast implants. This is a huge topic normally. I am trying to summarize. So, first of all, I guess all of you know or all of you have some information about breast implants. Breast implants are silicone-coated, serum physiologic or silicone-filled implants to increase the breast tissue, so for enlargement of the breast. They can also be used in different areas of the body, but are mostly used for breast enlargement operations. Who is a good candidate for breast enlargement operation? Any patient who has decrease in breast tissue, who has sagging of breast tissue, and who has no chemotherapy or radiotherapy to the breast tissue is a good candidate for a breast augmentation, so breast enlargement procedure. What type of implants are we going to use? This depends on the body shape of the patient, her expectations, and her skin quality. So, we can use round implants, which are silicone filled under the muscle or above the muscle, especially in patients who desire a prominent look on the décolleté area. For round implants, our main preference is the under muscle, under pectoral area. Why? Then we want them to look much more natural. Second, we also use very often teardrop shaped implants. Teardrop shaped implants are a little bit different than round implants. Then they have an anatomic shape which gives the breast its own shape, so they look naturally. Their silicone inhaled is different than of the round implants. It is much more harder to take the shape of the implant to give a long-lived shape for the implant, so they should remain their shape. We usually use mentor implants for teardrop implants. Mentor implants have lifelong guarantee for any problems which may be encountered in the implant. So meaning when they get off, when they have a hole, when there's a problem in the implant, etc. So they have a lifelong guarantee. How do we put the implants? There are three types of incisions by breast augmentation or breast enlargement. We used three different areas for placement of the implants. One of them is the axillary. The second is the periareolar area. The third one is the inframammarian fold. We mostly use the inframammarian fold in this Mediterranean area. Why? It is very easily hidden and it is the most physiologic area to put an implant under the muscle or above the muscle. So, can the patients breastfeed after the operation? Yeah. According to the American Society of Plastic Surgeons, after breast augmentation procedures, the woman can breastfeed. There is no change in the amount of milk and in the quality of lactation which they can give. So, the next question is always this. What happens if we have an implant? We still have to look for breast cancer, so we have to make our checks. Can this be done after breast augmentation? Yes, it can be done. You can have an ultrasonography and mammography if you have also an implant. We recommend that you have a good radiologist to see this, but especially manual physical evaluation of the breast for you to detect any tissue in the breast is much easier after a breast augmentation procedure. So how long does the breast enlargement operation last? It lasts nearly 1.5 hours. So how do we decide to put the implant under or above the muscle? This depends especially on the skin type of the patient. If the skin is very thin, we have to have an extra coverage for the implant. So then we use the under muscle area. Or if the skin has some laxity, so some sagging, especially after childbearing or lactation. Then we use to rise the nipple areolar complex a little bit up, the above muscle or subglandular area to place the implant. This helps us also to lift the breast nipple a little bit up. So, is there a scar? The scars in breast augmentation operations are nearly ignorable. Which part do you choose is not a big difference. The axillary incisions are nearly non-bearable after the operation. The periareolar area is the area where the least scar stays. But in any type of incision, we know that breast augmentation scars heal very, very well, and they are nearly ignorable. So, how long the postoperative period and healing process lasts? This depends on where we have placed the muscle, where we have placed the implant. If we place the implant under the muscle, we need at least 5 to 7 days for the early recovery time. If we place the implant subglandularly, so above the muscle, then 3 to 5 days will be quite enough for a good early postoperative recovery period. This doesn't mean that everything is over, that the breast has settled down. We know till the swelling has gone, till the breast has settled down, till everything will be normal, it will take nearly at least 6 weeks. So, have a nice day. Be happy. Thanks for listening to me.